So this afternoon is bits and pieces of science that is ongoing, maybe science of tomorrow, preparedness, women's health, animal alternatives and so forth. But the first speaker we already seen once today, although wearing another hat, but this time it is the real Sandra Gallina speaking on her own, talking about how do we embrace One Health. And I'm sure you're going to explain for the very, very few, if there should be anyone in here who don't know what One Health is. The floor is yours, Sandra, please.
Now, I don't think I will need to explain One Health, although we may have some discussions about definition of One Health, which is not as simple as it looks. In my usual self, I cannot read speeches. You must have noticed that too. I'm too short-sighted. So I will go with the first problem. The first problem is that we are interdependent. This is socially true, as I would say Guido was making the point in his speech. The social networks sometimes do cover up failings in terms of hierarchical structures, but you know, it's really true that humans and all beings are in the same broth. And you know, I was appalled to hear in Rome at a big do where we were discussing One Health, somebody who is an authority, I will not quote him, but the people who may have been in Rome may have noticed that I immediately said, you're wrong in saying us humans and animals. We are all in the same thing. Not too Darwinianly, but really because, you know, the environment puts us there. The paradigm shift has not happened though yet. You need to speak with your families and you will immediately realize that this thing of One Health is quite difficult to seize. They're not necessarily too convinced that what you're doing is really going to matter, till they discover that they have some antibiotic resistance, and you try to explain to them, well, perhaps you had too much chicken. I'm joking, but let me say, one of the experts from the, the SAM, we call it with this horrible acronym, the SAM, it's the experts that work scientific opinions for the Commission on very difficult topics. They did one big piece of, I would say, recommendations on, I would say, One Health. And one of the first topics is the whole of the antimicrobial resistance. And one of these experts had real antimicrobial resistance, and she almost died because they could not find an antibiotic that was working. It was barely the case that something in the reserve antibiotics worked. So she was really personally very much into this. But let me say to you, it's quite difficult. I would like to say that I am always objecting to people, including in the speeches of the Commissioner or in the speeches of anybody else, this figure of 35,000 people die every year out of it, because this is an estimate or a guesstimate. And in reality, what I have discussed sometimes with real scientists is that we may have much more than that. We may not be able to really put a real figure on the antimicrobial resistance, because the comorbidity of some elderly people that enter hospitals, wrongly so, because they are somehow parked there during summer and all, and get infections and can't be treated, it's never put down to antimicrobial resistance, but may be there. I'm just quoting, again, one example, but there is a whole host of, it's like the tip of the iceberg. So you hear this 35,000 and you say, okay, fine. Then you hear another figure which approximates more reality, which is the cost of antimicrobial resistance. This is a bit more sort of not scientific, but the accountants, the bean accountants know if you are absent from work or if you have sickness benefits. And they say that at least we in Europe are paying 12 billion every year, which is a modicum. And I'm somehow attracted to this number as closer to reality than the other one. In my view, when we work with OECD, I am trying to get, and I would like to thank them, Scarpetta, Colombo, and all of them, I'm trying to get many of these figures out of the cupboard of, you know, I need a figure for a speech. No, we're trying to really check on them. And some of these figures may be very useful for me, especially for the discussions on money, on the MFF, because I am saying constantly I'm one of the few DGs that still sits at the table for the discussions of the budget, meaning I'm not a budgetary DG, but I'm sitting there because prevention, for instance, we are very keen on prevention and preparedness, and I have somehow approximately something in the order of 40 billion in terms of, so I'm beyond the trivial. I'm saying to people, if we could do prevention, we could be sparing quite a lot, and this is the bigger pot. This is not just, I would say, for the antimicrobial resistance. You must know that the Swedish presidency was quite instrumental in getting a beautiful recommendation out. I was honored to meet, I would say, the big professor on this issue, but he was actually a bit depressed because it was the third Swedish presidency, and he was telling me, you know, we had so many presidencies and it's the third time that we go for yet another recommendation. Sweden is, I would say, the best pupil in Europe, and frankly speaking, we are stepping up our limitations for antimicrobials. We are now going into the real world by saying a reduction of 20% of consumption. You know that there is a real difficulty in terms of getting consumption down or getting only sales down. And this is the whole difference. If you go for the sales is one thing, if you go for consumption. So 20% in consumption is a real target. Now, will the member states be doing the right thing? I tell you, no. If you read the latest figures, there's an increase in antimicrobials. I must say, after COVID is a disaster. So it's a plea to you all, please make people aware that by using antimicrobials, by using an antibiotic for a virus, I mean, they are really killing us all. This is not good. So I must say that the monitoring also pertains to EMA, so thank you for this, because we can keep an eye on the use and how it is used, but at the end of the day, we also will need to have new antimicrobials. And here we have a huge discussion in the Pharma Review. You may be aware of this, about the transferable vouchers, the famous voucher. I am one who says that if a Nobel Prize finds that the voucher is good, I don't object to it. I got a lot of flack for this, but I must say that nobody has come with better propositions. There is other systems, but I am hearing that also the subscription system has its limitations because it's extremely expensive. In our proposal, the voucher is extremely limited. We said that we can have maximum 5 vouchers for 15 years, and I tell you, I wish I could give the 5 vouchers in the first 5 years. This will not happen because finding a new antimicrobials is not easy. So again, the pharmaceutical industry will be a real, I would say, catalyzer of this whole discussion, because at the end of the day, innovation will need to be paid, and I hope we will find, if vouchers are not the thing that people want, then find another solution, but otherwise we will not have innovation. I'm clear. I would say that EMA has been, as has been recognized this morning, instrumental in, I would say, the vaccine big campaign for COVID. It's still vaccine is an important word, because I may say that some of the diseases that we have to deal with because of the zoonosis coming over or for other infections could be stopped thanks to a vaccine. And here I come to the whole discussion that fascinates me with the scientists when we're trying to drive these very silly divisions between, I would say, the infectious diseases and the diseases that are not contagious and so on and so forth. And in reality, some of the conditions that become permanent conditions start with an infection. We have hepatitis that, you know, sprinkles from viruses, and then you may be getting into cancer. So let me say to you, many of these divisions are being blurred. What is important is that we go for, I would say, what we can use, and it's very important that we bear in mind that avian flu is something simmering next to us, and every day when I read news about the way that, the defenses may not be working, including for COVID, I get worried. So we need to be prepared. We need to be looking at the possibility of having the vaccines that we need. I think it's important that we mention climate. Climate has received lots of resolutions, and it's moving the line of certain diseases upwards. Certain things that were not seen in temperate climates are now quite easily detected. There is a project in Italy that was quite good on the West Nile fever, and I must say I quote it because this was the result of work by very different regions, and here again I would say going beyond the anecdotal, going beyond the local. Whenever Europe tries to unite at big, small level, whichever level it is, you are much more powerful, because with a hackneyed word I would say diseases know no borders. You will not be safe just because you're a different country or a different region. Now, we have, I would say, quite some experience, because you also need to realize that my Director General, that has all the health that is above the soil, meaning we are in charge of health for humans, but also of animals, plants, and I would say the wastewater and all of that you may be discussing. We have had, I would say, very strange experiences, because I also have the largest auditors body. We go and audit in different things. We may be auditing zoonosis, but we are also auditing for antimicrobials. And I will say to you, the situation in Europe is very different. In some countries where the levels are not particularly high in terms of revenue for the farmers, it's quite difficult to go and explain what it means not to use certain antimicrobials. They depend from the chicken that they raise, and they say to you, frankly speaking, we can't go without this thing. So we see the things. We are not completely, I would say, blind. We have fact-finding visits also around avian flu, and with my services we will need to do a plan, because one of the first things that the farmers will need to know is what to do if there is a cow that produces milk, and where does that milk go if the cow has avian flu. In Canada they did quite a good thing. We have had a huge a series of meetings which I call jumbo, with vets and I would say public health authorities. I consider that one success of my career, because it was difficult that the two worlds speak together, and still they need each other in this one health perspective. And one of the first problems is that you need to reach the farmers with public health ideas. We had this experience during COVID with the mink, and praise goes to Denmark that did the right thing, culling all the mink at the moment when there was this tragedy of COVID. The Prime Minister didn't hesitate one moment to go for that very harsh choice. So let me say to you, you need to be aware that One Health is permeating you more than you think, and in different ways. There are two things that I want to mention. One is that I immediately decided that I want to have one specific, I would say, part of my directorate that will be called One Health, because we need to be the pole of conjunction for the whole of the Commission on One Health, which is not an easy topic. People don't see the links, but then when you start working together, you at least start to build relationships. And we also had this fantastic idea to put 4 or 5 of our agencies together, including EMA. We have Frank here from EFSA, he is there. We have also, I would say, ECDC, which is an important agency in terms of public health. And I would say we have also the environmental, agency that was also one of difficult for them to work together at the beginning. Now it's getting better. So I'm being very honest with you. Working in silos is very practical, it's very easy, but working across the silos is what is very difficult. And I would like to say this is why One Health becomes a difficult topic, because you need to stretch yourself a bit. So thank you to EMA for stretching a bit beyond EMA and to do the work with us on this difficult topic. Thank you. Thank you.